Are you here to learn about glaucoma? Well, I promise you, after this video, you won't need to look anywhere else. In this video, I'm going to teach you what is glaucoma. I'm going to teach you the different types of glaucoma. I'm going to teach you a little bit about the aqueous humor production and the anterior chamber so that we finally understand the differences between primary open angle glaucoma and primary angle closure glaucoma. Hi guys, welcome to Bridging the Gap Academy. My name is Dr. Mustafa Khalil and it's my passion to teach you everything medicine and more. If you're new here, please consider pressing the subscribe button and ring the bell to find out when our next video is. So what exactly is glaucoma? Well, glaucoma is a group of diseases with characteristic progressive optic neuropathy, which is damage to the optic nerve, specifically the retinal ganglion cells. Now these all share a common glaucomatous optic nerve head damage, such as cupping, as well as glaucomatous visual field change, which we'll go on to cover. Now, to truly understand what glaucoma is, we must actually understand the anatomy of the anterior chamber as well as the anatomy of the aqueous humor production and drainage, because really glaucoma is due to a decreased drainage through the anterior chamber of the aqueous humor. So let's begin by understanding the anatomy of the eye in general. To start off with, we can see this sclera in white, and the cornea is a transparent medium which covers the blue iris. Now we can see the lens in white suspended by the zonules, which are themselves attached to the ciliary body. And finally, the big chamber in the back is the vitreous. Let's take a closer look. So the ciliary body, defined by the arrow in green, produces the aqueous humor, and this basically nourishes the eye. The part of the ciliary body that specifically produces the aqueous humor is called the pars plicata. So aqueous humor is produced through the pars plicata, and then it travels through the posterior chamber into the anterior chamber in the angle between the lens and the iris. Through the anterior chamber, then it drains through the iridocorneal angle, the angle between the iris and the cornea. And there are two main drainage pathways. The main drainage pathway is called the trabecular pathway, which drains over 70% of the aqueous humor. Now this pathway, the aqueous humor, travels through the anterior chamber, through the trabecular meshwork and Schlemm's canal. In the second pathway, it's called the uveoscleral pathway. Less fluid drains through that pathway. And in this pathway, it travels through the anterior chamber once again, and then into the ciliary muscle through the suprachoroidal space and out. Now, as I mentioned briefly, glaucoma usually occurs when the aqueous humor drainage is slowed down or stopped completely. And there's two main mechanisms for this. The main mechanism is what happens in what we call primary angle closure glaucoma. Now let's dive into this. We've talked a little bit about the angle. Now, angle closure glaucoma happens when there's a sudden closure of the iridocorneal angle, when the angle between the iris and the cornea suddenly closes. And what happens then is the trabecular meshwork is blocked and there's a sudden rise of intraocular pressure because the fluid is no longer able to be drained. This is a medical emergency because angle closure glaucoma can cause blindness really, really quickly. So what are the symptoms of primary angle closure glaucoma? Well, patients will come in with a headache and severe vomiting and a red eye. That's what patients will usually complain of. It usually happens during nighttime or during nighttime driving when our pupils are a little bit larger. What signs will we see? Well, when we see the patient, we'll see that they have a red eye due to conjunctival hyperemia. We will see that they have a raised intraocular pressure when we measure it, and the pressure will be very high. It will maybe be in the 40s or 50s. We'll usually see corneal edema because of the damage from the intraocular pressure. And finally, what we'll see is a mid-dilated pupil, which is unresponsive to light. On closer inspection, we do something called gonioscopy to have a look at the angle. And what we'll find is the angle is closed, and we do this to prove that the angle is closed. Now, the management of this is with IV acetazolamide, which is a carbonic anhydrase inhibitor. It's basically a diuretic, which is used to decrease the pressure in the eye very rapidly. And we use other methods to decrease the pressure, such as put in topical beta blockers and topical prostaglandin analogs, which all reduce the pressure within the eye. Examples of these is timolol and latanoprost. Now, in the long term, what happens is once the eye pressure has settled and the patient is now comfortable, then we do something called a bilateral peripheral iridotomy, which is basically laser into the iris, and it creates a small tiny hole which relieves the pressure between the back of the eye and the front of the eye, stopping this condition of primary angle closure from happening again. Now we've covered primary angle closure glaucoma. So what about primary open angle glaucoma? Now, primary open angle glaucoma behaves a lot differently. The angle is actually open, so the angle between the cornea and the iris is open. So it's a silent disease where the intraocular pressure rises very slowly and it creeps up on us. It's usually asymptomatic, so we don't know what's happening unless we go for an eye exam, for a routine eye exam, and they tell us that we have signs of primary open angle glaucoma. Since the angle is open, it makes us wonder what causes intraocular pressure to rise. Well, no one truly understands, but it's believed to be due to reduced aqueous outflow. So what are the signs of primary open-angle glaucoma? Well, for one, the intraocular pressure is usually high, and it's higher than 21. The normal range is 10 to 21. So if someone has an intraocular pressure of more than 21, we can start to suspect, is there primary open-angle glaucoma or is there not? The second thing is optic cupping. So let's first have a look at what a normal cup to disc ratio looks like. As you can see in this video, the cup is the inner circle pulsating and the disc is the outer one. Now, a normal cup to disc ratio is usually 0.3 or a third, whereas we suspect glaucoma if it's more than 7/10 of the disc ratio, such as this cup, which we can see is clearly abnormal compared to the first one. Now, the third thing is glaucoma is a disease of blindness and it causes visual field defect. Primarily, it actually affects the peripheral vision. So if we look at this image here, this is what a normal person would see. They would see a clear image of everything. And if we compare that to what someone with advanced glaucoma may see, as you can see in this image, the peripheries are all blacked out. They can only see central vision. This is advanced glaucoma. Now, open-angle glaucoma is a silent disease because it doesn't start off like this. It starts off with simple things like in the diagram here. These are characteristic glaucomatous visual field changes, such as nasal step, such as an arcuate defect, such as a ring scotoma, and finally the tunnel vision, which we got to see earlier. To stop open-angle glaucoma from happening and progressing and causing blindness, we must be seen early, and the way to do this is through screening programs for open-angle glaucoma. Now, you should probably get your eyes checked, maybe once a year, maybe once every couple of years if you're completely normal, and you can chat to your optometrist to see how often you should be getting your eyes checked. If picked up early, treatment is actually very simple. We usually use topical eye drops, such as beta blockers like timolol, and the whole concept is if we decrease the intraocular pressure, then the optic nerve won't get damaged. So we can use beta blockers such as timolol, or we can use prostaglandin analogs such as latanoprost. And females tend to like this because it increases the length of their eyelashes and it makes it more dark. So people actually tend to like this side effect. Now, if all medical therapy fails, there are some surgical options, such as a trabeculectomy. Now, what a trabeculectomy simply is, I won't go into it, is it basically creates a fistula or a canal for aqueous drainage for the fluid to drain out the eye and reduce the intraocular pressure. If you'd like to learn more about a trabeculectomy or a trabeculoplasty, please leave a comment down below and I can make a video to explain this properly. Alright guys, I hope you've enjoyed the video. I hope this teaches you about glaucoma, and if you have any questions, please leave them down below. I can make a further video if you would like. If you've enjoyed the video, please press the like button and please press the subscribe button to help us create more videos for you. Now, question of the day, do you have glaucoma? Does one of your family members have glaucoma? Please leave a comment down below and let me know. If you have any questions, please leave it down below. If you'd like to know about secondary cause of glaucoma or one of your family members has that, you'd like to make a video to explain it, please let me know down below. Okay guys,